Infections during pregnancy can hurt both you and your baby. Thankfully, you can improve the chances of having a typically developing baby with a few extra precautions to avoid getting sick. Here's what you can do while you're pregnant to protect yourself and your baby from infections. Maintain good hygiene. Hand washing is one of the most effective ways to stop germs from spreading. Wash your hands and your children's hands often with soap and running water for at least 20 seconds. Dry your hands thoroughly using a clean towel when possible. If soap and running water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Keeping your hands clean is one of the best ways to remove germs and avoid getting sick. It can help prevent congenital cytomegalovirus infection, which is the most common infectious cause of birth defects. Congenital CMV happens when a baby is infected with the cytomegalovirus before birth. Most people don't have symptoms, but about 1 in 150 pregnant women will get CMV. According to the Centers for Disease Control and Prevention, most babies will be okay, but some may develop serious health problems, including hearing loss, vision loss, learning disabilities, cerebral palsy, seizures, microcephaly, and even intellectual disability. Some infants will have more than one of these conditions. Infants with congenital CMV may also have a low birth weight or be born prematurely. Cook your meat until it's well done. Meat juices should run clear and there should be no pink inside. Ground meat should be cooked to a minimum of 160 degrees Fahrenheit. Cook poultry to at least 165 F. For other meat like beef and pork, cook it to a minimum of 145 F and let it rest for several minutes after cooking. Don't eat hot dogs, luncheon meats, or deli meats unless they are reheated until steaming hot. These undercooked meats and processed meats might contain harmful bacteria called Listeria monocytogenes. Listeriosis is a rare foodborne illness caused by the bacteria Listeria monocytogenes. Symptoms usually start within a week of eating contaminated food. While many people experience only mild symptoms similar to the flu, listeriosis can be dangerous for pregnant women, newborns, older adults, and people with weakened immune systems. For pregnant women, the infection can cause a fever, weakness, muscle aches, and sometimes gastrointestinal symptoms. The biggest concern is that the infection can pass from mother to baby during pregnancy or delivery. This can result in a miscarriage, stillbirth, or serious health problems for the newborn. The CDC recommends that pregnant women and those at higher risk avoid eating the following: hot dogs and luncheon meats unless heated, raw or unpasteurized milk and foods made from it, such as cheese and ice cream, soft cheeses such as feta, brie, and queso fresco, unless they have labels that say they are made from pasteurized milk, refrigerated smoked seafood unless it is in a cooked, heated, and sealed package, and any meat, poultry, or egg dishes that have been sitting out at room temperature for more than 2 hours. Protect yourself against insects known to carry diseases. Infected mosquitoes and other bugs, such as biting midges, can transmit the Oropouche virus and the Zika virus, which are linked to birth defects. Tick bites can spread diseases like Lyme disease too, which can cause pregnancy complications if it's left untreated. When biting insects are active, wear long-sleeved shirts and long pants when you're outside. Avoid traveling to areas where infections can threaten you and your baby. Travel alert: Oropouche virus. Oropouche virus has been reported in several countries in South America, the Caribbean, and Central America. As of December 3rd, 2024, there have been 94 cases of Oropouche virus disease reported in U.S. travelers. Most had a fever and other symptoms that went away without treatment. Oropouche virus is spread to people through the bite of infected biting midges and certain mosquitoes. Common symptoms include fever, severe headache, chills, muscle aches, and joint pain. The infection also may cause problems during pregnancy, including birth defects or death of the fetus. The best way to avoid the disease is by preventing bites from infected biting midges and mosquitoes. If your family is planning to travel to areas with outbreaks of Arapush, check the U.S. Travel Health Notices page before you go. People who are pregnant are urged to reconsider travel to areas with a Level 2 travel health notice. See notice to avoid travel to the southern coastal region of Brazil due to an outbreak in Espírito Santo. Talk to your doctor about vaccinations. Some vaccines are recommended before you become pregnant, during pregnancy, or right after delivery. Having the right vaccinations at the right time can help keep you healthy. For instance, the flu vaccine is especially important when you're pregnant. Vaccinations can also help keep your baby from getting very sick or having lifelong health problems. Get tested for sexually transmitted infections. Some people that have STs do not feel sick or have any symptoms. It's important to know if you have an STI when you're pregnant. That's because an STI can have serious effects on you and your baby. Recently, there has been a sharp rise in babies born with syphilis, a life-threatening STI that can pass from parent to fetus. If you do test positive for an STI, talk to your doctor about what you can do to protect yourself and your baby. Some STs are treatable while you're pregnant. Be sure you're using safe sex practices to prevent STIs. Ask your doctor about Group B streptococcus. About 1 in 4 women carry this type of bacteria, but do not feel sick. An easy swab test near the end of your pregnancy will show if you have this type of bacteria. If you do have a GBS infection, talk to your doctor about how to protect your baby during labor. Avoid people who have an infection. This is especially true for infections like chickenpox or rubella. Chickenpox can cause pregnancy complications and birth defects. Rubella can cause serious birth defects and put you at risk for miscarriage or stillbirth. Stay away from anyone who has these infections and stay up to date on vaccines before and during pregnancy. Have someone else do it. If you have a cat, ask someone else to clean the litter box for you, especially if you are carrying a kitten. If you must change the litter yourself, be sure to wear disposable gloves and wash your hands afterwards. Dirty cat litter might contain a harmful parasite that causes an infection called toxoplasmosis. If you have a pet rodent, like a hamster or guinea pig, have someone else care for it until after your baby arrives. Some rodents might carry a harmful virus that causes lymphocytic choriomeningitis. A study published in Clinical Infectious Diseases found that pregnant women are at higher risk for infection with LCM, which can lead to miscarriage and stillbirth. Plus, infants can get the virus at birth, leading to hearing loss, paralysis, developmental delays, and even death. Rodent droppings can also harbor the virus. And finally, stay away from wild or pet rodents, lizards, and turtles. Have a pest control professional get rid of pests in or around your home. It's never too early or too late to talk to your healthcare provider about your baby. Find an obstetrician gynecologist near you with the March of Dimes. Find an OBGYN tool. We're here for you before, during, and after pregnancy and birth. Visit our website for the latest information on pregnancy and parenting. Join the conversation on social media and follow us for more.